Conference Committee on Senate File 4410. And are we broadcasting? I think maybe we have to tell House Information that I think we have to give the 10-second warning. So let me do that right now.
Madam Chair, the viewing audience, the massive audience, is lined up outside their houses waiting to have their TiVos work.
All right, so I think we are actually live. I'm not 100% sure, but I think we are. So we'll call to order this Conference Committee on Senate File 4410. I just first would like to thank everybody for your patience, because we have kept pushing back the time of our meeting, and that's kind of what happens with conference committees, because in the meantime, we've all been working to try to work out more agreements, to get amendments prepared, to make sure that, you know, we get done whatever we're able to get done in this meeting. And I especially want to extend my appreciation to all of the staff, both partisan and nonpartisan, for all of the work that you continue to do to get this ship to sail. And hopefully it is going to do that. So the plan for today, we have a list like we did yesterday, that how we started off when Senator Abeler had the gavel. We started off with a list that was put together for us by nonpartisan staff. And the list is all agreed upon items that we are ready to adopt into the conference report. So we will, I think, do the reverse of what we did yesterday, and we'll go through these items, ask nonpartisan staff to just tell us briefly what they are, and then Senator Abeler, I would look to you to make motions to adopt amendments or to move various sections for adoption into the conference report.
Thanks, Madam Chair. And on our end here, the lists are just being distributed. So they're still warm from the printer, I think. So once we can start in about 30 seconds with that.
All right, very good. And we do, just for the public also, we have quite a few amendments as well. And I don't know this, but for sure, but Mr. McQuillan, are those to be found on the committee page also for the public?
Yep.
Great, okay. So those, for anyone watching who would like to look up those amendments, they are on the House Health, Finance and Policy Committee web page on the House, that can be found on the House website. So, okay. So whenever, Senator, whenever you are ready, and just, I could say too, just to use a little more of the time here while he's getting ready, that the intention here is to go through these items that are agreed upon, and there might be some others that we could discuss. I hope that we're going to have just a really collegial, and, you know, if there are items that are not agreed upon that members need to really, you know, bring forward to discuss, we can certainly do a little bit of that. I hope we won't get into a big contentious thing. There were just some things that were kind of, people think are maybe agreed to or could be agreed to, but we haven't got 100% agreement. We haven't been able to get in touch with each other, or for whatever reason, that we might want to just see if there is agreement and we can adopt them without, you know, without any big, hopefully any big debates tonight.
So, Madam Chair,
yeah,
we have our papers. So if you want to start, then.
All right, we will do that. And then I should just say then that our intention is, after we get through all of these items, our intention is to recess, hopefully briefly, so that the staff can make sure that everything is in order. And then we will, our hope is to close up the policy portion of the bill this evening. So,
Madam Chair, I think If we're going to be done, we might want to even consider just moving it out, but that's something we can talk about. We haven't talked about that, so.
Yes, and I think that's why I think we want to have that pause. when
Oh,
we get this
absolutely,
part
yeah.
Wrapped up, and we'll do
Madam
some
Chair,
more
you want to,
discussion
we're in
offline.
total agreement on that point. See, we can build on that.
Excellent.
The Board of
See,
Pharmacy,
that's right.
it's all good.
Yeah, Senator Abler, we actually agree on quite a bit. Truth be known, I know some people don't want to admit that, but sometimes I don't want to admit that. We actually do agree on it. So, okay, so if nonpartisan staff would start, we have first House Article 2, Senate Article 13, Department of Health Policy.
Madam Chair and members, the first document for consideration is SCS 4410A135 with the S4410A110 amendment. The A135 amendment establishes criteria for an assisted living facility variance from the requirement that all facilities offer the option of a bathtub, and the A110 amendment modifies the facilities to which the variances apply and the criteria.
So I should move the A135, Mr. Monahan, first.
Ms. Sunderman, which one should we move first?
The A130. Madam Chair, I'll move the A135.
Yes, sorry.
And then, Madam Chair, I'll move the A110.
Well, Mr. Chair, I think we need to move one at a time.
No, it's an amendment to the amendment.
Okay, so so which one is the main amendment?
135.
So we should probably, okay, so you want to move the so the A135 is before us, and then you want to move the other one to amend it? Is that
Right.
how-
This was an agreement today.
Okay, so you've moved the A135 and now you've moved the A110 to amend the A135, correct? Ms. Sunderman, is that?
That's correct, Madam Chair. Yes.
All right, so all those in favor of adoption of the S4410A110 amendment to the amendment, please say aye.
Aye.
Any opposed? The motion prevails, and then,
And Madam Chair, I'll move the A135 as amended.
thank you. All in favor of the motion, please say aye.
Aye.
Any opposed? The motion prevails. Oh, I'm sorry. Ms. Clark-Fist, I keep calling you Ms. Sunderman. I'm sorry. No wonder you looked at me with that blank look on your face. I'm sorry about that. It's all over Zoom, Okay. And of course, your name is on the screen too, that should be a clue. All right, next.
Madam Chair and members, the next amendment for consideration is the S4410A108-1 amendment, and this modifies base level funding at DHS and the Health Department to account for moving fetal alcohol spectrum disorder grants from DHS to the Health Department.
Madam Chair, I'll move the A108-1 amendment.
All right, thank you. Any questions about that, members? All right, seeing none, all in favor, please say aye.
Aye.
Any opposed? Motion prevails.
The next amendment is the S4410A109 amendment. This appropriates money to DHS for the Eliminating Duplicative Background Studies initiative.
Madam Chair, I'll move the A109.
All right, thank you. All right, all in favor of the A109 amendment, please say aye.
Aye.
Any opposed? The motion prevails. Now we're on to the House Article 5, Senate Article 14, the health-related licensing boards.
Madam Chair, I believe that might be mine. So the first item is to adopt the S44110 A0107 amendment. And this is a small state government special revenue appropriation to the Board of Dentistry for the some language that we previously adopted. It was a small fee that was put in.
Madam Chair, I'll move the A107.
Thank you. Okay, questions? Seeing none, all in favor, please say aye.
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 Any opposed? Motion prevails.
Madam Chair, the next item is to move to adopt the SCS 44110 A138 amendment, and this is fixing a emergency medical services regulatory board appropriation.
Madam Chair, I'll move the A138.
Thank you. Any questions? Seeing none, all in favor, please say aye.
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 Any opposed? Motion prevails.
And Madam Chair, the last item in this article is to move Senate Article 14, Sections 20 and 21. These sections permit a collaborative practicing dental hygienist to be employed by a licensed dentist. And then there is an amendment, the SCS 44110 A141, and this basically takes out of Section 20 the cost to that. So there was a report that DHS had to give to the Board of Dentistry. So the A141 removes that language. So it would be to move sections 20 and 21 as amended by the A141.
Madam Chair, I move the A141.
All right, the A141 is before us. Are there any questions? Seeing none, all in favor of adoption of the A141, please say aye.
Aye.
Any opposed? The motion prevails.
Madam Chair, I move Senate Article 14, Sections 20 and 21 as amended by the A141.
Right. All those in favor, please say aye.
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 Any opposed? The motion prevails. And the amendment is, or the section is adopted. And so now we're on to House Article 8, Senate Article 8, Community Supports and Behavioral Health Policy.
Madam Chair, members, excuse me. In order to accomplish the intent of the conferees, we need to first move to reconsider the motion which by Senate Article 8, Sections 10 to 12, as amended, were adopted.
Madam Chair, I'll move to reconsider the motion by which Senate Article 8, Sections 10 and 12 as amended was adopted. Were adopted.
All right. And Mr. Monahan, could you just tell us really briefly what it is?
You adopted some sections about ICF DD capacity limits and the sixth bed in group homes, and you amended that language, but now they would like to make the amendments that you made sunset, and to accomplish that, we need to modify the effective date. So we need to bring those sections back in front of the committee in order to amend the effective date.
Okay, thank you so much. Okay, any other questions on that? All right, all in favor, please say aye.
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 Any opposed? The motion prevails.
Madam
and
Chair, can I ask
that's-
Mr. Monahan a question? Is this going to adjust both the ICF 6 to 8 and the group home 5 to 6 waivers? Is that both items that are sunsetted or just the sixth bed?
You've stumped me.
Oh, I didn't mean
Let me
to.
look
Mr. Chair,
Somebody knows.
No, no.
Mr. Chair,
Yeah,
Danielle Pinelli
Ms.
from
Pinelli.
House Research. The updated amendment is only amending sections 10 and 12, which I believe are the two sections that have to do with the ICF DD licensed capacity.
Yes.
are you good with that, Senator Abler?
I'm just making sure what we're doing. So this is the sixth bed or not? Or is it both?
Madam Chair, Mr. Abler,
Monahan.
Mr. Abler.
We're all
You
tired,
worked very
Mr.
hard.
Monahan.
Totally
When I
cool.
can't tell Sunderman from Clarkfest, then I'm tired, and you're tired, we're all tired.
It is not making the variance language temporary. It is only sunsetting
The 6-bed.
the ability to increase ICF capacity in a single-family home from 6 to 8.
Okay.
It's
Thank you.
not affecting the 6-bed variance in group homes.
Thank you. Madam Chair, I'll move, what am I moving?
Okay.
So I'm moving the
so-
A105-1 amendment.
All right, so Senator Abler is moving to adopt the S4410A105-1. All in favor, please say aye.
Aye.
Any opposed? The motion prevails. The amendment is adopted.
Madam, I'll move to adopt Senate's Article 8, Sections 10 and 12 as amended.
All right, that is before us. All in favor, please say aye.
Aye.
Any opposed? Motion prevails, and those sections are adopted. Okay, we're now on to House Article 10, Senate Article 4, Behavioral Health.
Madam Chair and members, the only item in this in this article is to adopt the excuse me, the S4410A93 amendment, which codifies the governor's executive order establishing the opioid substance use and addiction subcabinet and advisory council.
Madam Chair, I'll move
Right.
the A93 if you like, unless you want to move it.
Oh, no, that's quite all right, Senator.
Thank you.
It doesn't
I'm happy to
matter.
move it, Madam Chair.
All right, very good. And members, this is what we discussed at length last night, and we're in agreement on this. So all in favor of adoption of the S4410A93 amendment, please say aye.
Aye.
Aye. Any opposed? The motion prevails and the amendment is adopted. The next section, the next article is House Article 12, Senate Article 2, Continuing Care for Older Adults.
Madam Chair, members, the motion here is to adopt the S4410A 134-1. This amendment is related to the elderly waiver disproportionate share rate floor proposal. It's making some modifications to the original proposal by modifying the proportion of waiver recipients and elderly waiver recipients that need to reside in the facility in order to qualify for the rate floor. And it is modifying the effective dates of the provision.
Madam Chair, I'll move the A134-1, and I do have a question just for the department to clarify, if I may.
Sure, go ahead, Senator Abler.
Mr. Pollack, who's over there. So we were on the phone, and so the September, you told me means September 30th, and I don't have the language in front of me, but is that what we mean to do? Or do you want to comment about that?
I don't know, let's see, who's here
Mr. Pollack,
from?
is he there?
Mr. Pollack, I'm not sure
Oh, I
if
don't
he's
know.
on, but if he is, or someone from DHS, if there's someone who could respond.
This is, excuse me, Madam Chair, this is Nicole Stockert with the Department of Human Services. Senator Abler, I will look into the, you're saying it's September 30th that you thought would be the effective date for the rate floor?
Well, there was some discussion with September or October, and so Mr. Pollack mentioned just a little while ago that he thought of September 30th, which is almost the same as October 1st. But I just want to be sure we're amending the right thing. We can come back and fix it if we have to, but I'm really happy we can move forward with this. It seems October would be preferential to September 1st if that's the situation, although I'm happy to get it done any old way, so.
So
And if-
Senator, would you prefer that we just skip this and come back to it?
I just simply want to clarify so it's clear then, because Madam Chair, this is a conference committee and we're not going to get another bite at this apple, so.
Yeah, absolutely. So let's just.
Okay, I'll withdraw
you know
that, Madam
what?
Chair.
All right, we will just, you know what, if, Ms. Stockard, and if you could maybe confirm that, in the meantime, we'll come back to that item.
Absolutely happy to do that.
Thank you. All right, we're now then on House Article 14, Senate Article 10, Child Protection.
Madam Chair, I'll move to adopt House Sections 1, 3, 5, and 23. Oh, they didn't describe it first.
Yeah.
Sorry, I jumped the gun. I'm just so
that's
excited
cool.
about this particular section, Madam Chair.
That's all right. Who can, from our staff can describe it?
Madam Chair, members, this is to move to adopt House Sections 1, 3, 5, and 23, as Senator Abler said. These sections remove the requirements for courts and local social services agencies to order parents or custodians to use income attributable to the child or to the parents to contribute to the child's cost of care. It makes it permissive instead of required, and also adds factors for the agencies to consider when deciding whether to order it.
Madam
Great,
Chair, I've
so-
already moved it, so.
Yes, you have. Okay, very good. So any questions on this? Seeing none, all in favor, please say aye.
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 Any opposed? Motion prevails. Thank you. Okay, House Article 16, Senate Article 5, Economic Assistance.
Madam Chair, the item in this article is to move Senate Article 5, Section 1, which is related to SNAP income eligibility. It's just modifying that. And there are two amendments that go with that section. There's the S4410A96, which modifies the language related to verifying SNAP work requirements. And then there's also the S4410A103 amendment, which adds a special effective date.
All right, Ms. Prunelli, do we need to move one or the other first, or they're just two different amendments for the same section?
Thank you, Madam Chair. And so I just want to verify at least the big picture. I see that the there's been some technical assistance on the work requirements. And I think that's, I've not seen this amendment till now, but I think that's reasonable. So we're going to 200 with the departments advising the counties of their responsibilities. Basically, is that, Ms. Prunelli, is that the upshot of this?
Yes, Madam Chair, Senator Abler.
Okay, thank you. And so I should move,
Either of the, we can do
oh,
one
they're both?
amendment and then
All
the
right,
other
Madam
one.
Chair, I'll move the A96 then.
All right, so the A96 is before us. All in favor, please say aye.
Aye.
Aye. Any opposed? The motion prevails.
Madam Chair, move the A103.
All right, the A103 is before us. All in favor, please say aye.
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 Any opposed? The motion prevails.
Ms. Prunelli, do I need to move that section as amended, or is that all done now?
Madam Chair, Senator Abler, yes, you need to move that section as amended. It's
All right.
Senate Article 5, Section 1.
Okay, I'll move Senate Article 5, Section 1 as amended.
Right. All in favor of that motion, please say aye.
Aye.
Any opposed? The motion prevails and the section is adopted. Okay, we're now on to House Article 18, Senate Article 10, Preventing Homelessness.
Madam Chair, this article, there's one amendment for consideration. It's the SCS 4410A136 amendment, which dedicates $1 million of existing appropriations to repair and improvement grants for facilities of providers of services to homeless youth beginning in fiscal year 2024.
Mr. Chair,
Madam
Mr.
Chair.
Monahan?
Madam Chair.
Madam Chair, sorry.
It's okay, we don't worry that much about gender.
I apologize. This is, I think, my mistake. In looking at this, I'm not sure that it's right. So I think perhaps you should set it aside and
Okay.
just let me double check and maybe get back to it.
Perfect.
All right, happy to do that, sure. Okay. All right, let's move on then to House Article 19, Senate Article 11, DHS licensing and operations.
Madam Chair, this article there's two items for consideration. The first is to adopt House Article 19, Sections 1 and 5. And these establish requirements for primary providers of care in special family child care homes. And then there's the S 4410A104 amendment, which drops a requirement for primary providers of care to comply with rules governing group family child care providers.
Madam Chair, I'll move the A104 amendment.
All right, the A104 is before us. Any questions to that? Seeing none, all in favor, please say aye.
Aye.
Aye. Any opposed? Motion prevails.
Madam Chair, I'll move to adopt House Article 19, Sections 1 and 5 as amended.
All right, that motion is before us. All in favor, please say aye.
Aye.
Any opposed? Motion prevails.
Madam Chair, the second article, the second item for consideration is to adopt House Article 19, Section 27. And this allows DHS to carry out pilot projects related to its efforts to modernize childcare regulations. And then there's the S 4410A100 amendment, which deletes the requirement for the pilot projects to end by February 1st, 2024.
Madam Chair, I'll move the A100.
All right, Senator Abler is moving the A100 amendment. All in favor, please say aye.
Aye.
Aye. Any opposed? The motion prevails.
And Madam Chair, this could be just a very interesting project, and I'm thank Representative Pinto for bringing it forward, and I'm glad there's no limit on time, because maybe they'll think about something later. So I'll move to adopt House Article 19, Section 27 as amended.
All right, that motion is before us. Any discussion? Seeing none, all in favor, please say aye.
Aye.
Aye. Any opposed? The motion prevails and those sections as amended are adopted. All right, I wonder if we now could go back to House Article 12, Senate Article 2, the continuing care. There's been any success in clarifying Senator Abler's question about, I think it was about the effective date. DHS?
Maybe come back a little later.
Doctor? Okay, all right, maybe she's still working
And Madam
on
Chair,
that.
if we have to, we can deal with this during the break too. So it would
Sure.
be nice to know, it seems to, many people would prefer October if it could be. I thought September 30th is almost the same as October 1st. So it's just,
Okay,
Senator Hoffman in the room with you, Senator Abler?
is Senator Hoffman here?
yes.
I think was he working on this with an advocate, the date?
Senator Hoffman, did you want to weigh in on this?
Absolutely, Mr. Chair, Madam Chair. Actually, Senator Abler, you were there having the conversation afterwards, and there, it's okay. There's a couple of things that come into play. Is the timeline, right? 30 days is a hard time. 90 days is better, and so what they wanted was if we go to September and then going to January 1, 2023, as Assistant Commissioner Pollack said, it's okay if it goes to January 1 of 2023, and if Dan Pollack's on, if I'm misquoting you, Dan, then I misread your comments, but that's it's good to go, Senator Abler. This is
I just
clean.
want to get my question answered. Mr. Monahan, can you just tell me like where the article is this is going in? Because I don't know which one Senate Article 2 is, or whatever it is.
Oh, I see.
Oh, it's House Article 12.
It's Article 12, and it's on R19.
All right, and I don't want to take up time now, but so Senator Hoffman Mr. Pollock said June 30th, September 30th. It may well be September 1st. And some people may indeed have a little more time to qualify to get in time for that cutoff, that's all. So we don't have to resolve it now, there's plenty of things to do, so.
All right.
Yeah,
All right,
so let's
we'll
just
come
sit on
back
that.
to that.
Yeah,
No problem.
but this is a really a big improvement, Madam Chair, just so, I'm just happy to get this agreed to by this group. And I'm glad it's a conference report, because this, we've been trying to help reward sites that take more, actually, state clients, elderly waiver and caddy and so on. And this will remove lower the threshold from 80% elderly waiver to 70. And most of the ones that have that many elderly waiver anyway already exceed 80 and even 85% Medicaid. So then they'll qualify for a significant boost in their income, so we can actually keep serving these folks. So anyway, that's the topic. So just, we can move on, Madam Chair.
Well, very
Madam
good.
Chair, we need to revisit, and we might need to do this on break, but the sunset for the ICFDD and the sunset for the sixth bed variance on the group homes was supposed to cover both sections 10 and 11. And if Mr. Moynihan can look at the amendment that we adopted, that amendment.
Madam Chair, the section or the amendment that was adopted sunsets sections 10 and 12. And it was my understanding that section 11 didn't need a sunset per DHS licensing staff. I believe the only change in that section that's left after an amendment was adopted last night is a new paragraph H.
Okay, so
Madam Chair, what page are we
Senator
working on?
Abler's question, we did sunset the sixth bed to your question, Senator Abler.
And the 8 bed.
Oh, okay.
Can we look at what
good.
page that is? Could somebody just help me with that? Mr. Monahan or somebody?
It is R14 and R16. and
What article?
8, Senate Article 8.
What House
Page
article, please?
182 and page 184.
I just can't hear. What House article? Madam Chair.
Okay, this was House Article 8.
8, thank you.
It's also Senate Article 8, as it
Oh,
happens.
what a coincidence.
And it's, yeah, once in a while, stop clock.
And what section, Madam Chair?
And we're talking about sections 10 and 12, I believe. And we don't have an R here on the sheet.
Can you find the amendment that we adopted? Oh, the one that we... And what was the number of the amendment that we did for that one?
That was the A105-1.
That's right. Thanks. It's 182. Wait. Oh, we're on Senate language. Okay. And then line 24, 22. Looks to me like we only sunsetted the 2 places where it talks about 7 to 8.
Okay, we're going to work on something and come back after recess and then
Yeah.
address any
And then-
problems. So we can move
Okay,
on.
and,
now.
and I understand that Ms. Graum from DHS is available and could comment. I think that's
Madam Chair,
what-
just a comment if I can too. You know,
Sure.
there was some concern about this, and it's purely a way to try to help solve some of the issues. And a 1-year sunset is fine. I think a 2-year sunset would be better. I think we're in some really hard times coming. And if we're not careful, everybody's going to be in an assisted living or a nursing home somewhere. And this is an effort, as an advocate, to make sure that people have a place to go with some choices. So that's the intent of it. So everybody's all dusted up, like, oh, what are you doing? And we're not doing anything. But when you start finding, 4 openings for 1 applicant, this stuff might come in kind of handy. And so I'm happy to keep a short leash on it, and I'm curious how it works, but it's just meant to be a stopgap in really hard times. So, Madam Chair, that's all I got.
Yeah, and Senator, I appreciate that. I've been getting a lot of emails from disability advocates with real concern about this. And
Yeah.
I think your intention is absolutely the right one. I mean, we all are going to we are grappling with a shortage of people, a shortage of workforce. There is no question about that. And so trying to find solutions to how are we going to deliver care with a smaller workforce is absolutely critical. But we also, there's been just a lot of concern from the advocates, the people who are closest to this issue, and they are really concerned. And the concern I heard about the sunset, needing a sunset, is because they're afraid that there will be providers who will rush in and build new facilities based on the larger numbers, and that will be de facto doing that. And they don't, they're willing to try it, but they don't feel that, kind of hardwiring it into the system is a concern. At least that's what I read. I'm not deeply steeped in all of this, but there's real angst among the people who care very, very much about people with disabilities and their choices. And so I think that it's important to listen to those folks as well. And I was really appreciative of Chair Schultz working on this with the sunset, so that was the concern.
Madam Chair.
You addressed it.
Madam
Yeah.
Chair, can I just remark, I don't know, I don't know if there's a lot of providers rushing into this niche, so I just wanted to,
Well,
the thought of
I might
somebody
have
racing to build a nice
misstated
8-unit
that,
place, it would be, I hope they do. Please, come to Minnesota.
Yeah. All right.
Thank you, Madam Chair.
Well, look, let's move
Yeah.
on from this if we're not, do we need to revisit it right now? No,
Yes,
right?
Chair Liebling, we'll revisit it when we have some language to address this problem when we come back
Okay.
from recess.
Okay,
They're
and we
working
don't
on it
we don't need to hear from Ms. Grom then either right
now.
now?
No, we do not.
Okay, all right. Very good. So in the meantime, I don't know if Mr. Monahan is ready to move forward with the piece that we held up on House Article 18, Senate Article 10. Was that something that we still need more time on, Mr. Monahan? Mr. Monahan, were you ready on that piece yet or not? It's
Madam
fine if
Chair,
you're not.
it's me, Mr. Albrecht.
Oh, I'm sorry. Yeah, go ahead.
I do need some time to double check with my friends at the Department of Human Services who, if they check their phones, would see what I think the correction is. So just maybe a few more minutes.
So, Madam Chair, we could move on to the hashtags if you want.
All right, let's do that. Let's do that. And I'm sorry, sometimes I'm not always seeing whoever's speaking, I'm not always seeing your little square pop up on my screen. So sometimes I actually don't know who's speaking. So sorry, Mr. Albrecht. Okay, so we're on the what's called the list of hashtags. And just so for people who may not know how all this works, on our spreadsheet, there were a number of items that were indicated. They're not actually fiscal items, but they were on the spreadsheet just to kind of keep them in mind. And so when they were agreed to by one side or the other side, they got hashtags in those spaces. And so it was noted that there were a number of areas of agreement. And so we're essentially going to be adopting those provisions that were indicated on the spreadsheet, but that were not fiscal items. So that is what this is. And so go ahead. I don't know if the nonpartisan staff is going to walk through this, I hope.
Madam Chair, I think that'd be a good idea. And just, there's agreement on most of these, but I think the ones we don't agree on, it'd just be worth to chat about it. Maybe we agree after all. We have not spent very much time on some of these projects. And so if we have to hold, by the time we come back from the recess, we could decide yes or no, either you or I, whichever ones we don't agree on. So thank you.
Well, we do have the list here that are ones that we do agree on, ready to be adopted.
Yeah, let's
just
do
like
that.
we had the others. And so I thought that was what we were
Sure.
going to do right now. So if nonpartisan staff are ready, if you could go ahead and walk through, we'll do these just like we did the other ones.
Madam Chair, members, so we're going to go off the offer sheet lines. I'll briefly describe what they are. Some of these, there is language in the bill to be adopted. Others, you've actually already adopted, and some require new language to accomplish the intent. So on the offer sheet, line 151 was the children's mental health respite care clarification. There's language related to that. It is Senate Article 4, Sections 8 to 9, and that language can be found on R10 in House Article 10.
So, Madam Chair, I'll make the motion and people can talk to the motion. I'll move to adopt in the conference committee report, Senate Article 4, Sections 8 and 9.
All right, is there any discussion to that motion? Seeing none, all in favor, please say aye.
Aye.
Aye. Any opposed? The motion prevails.
Madam Chair, members, the next line of hashtag items that was agreed to was line 152. Those were the HCBS spending plan technical modifications. The conferees have already adopted those sections when they adopted the forecast article the other, I guess, yesterday.
Never mind.
So no action is needed on that item. The next item was line 154. This was the interaction between the spend down changes that were enacted last year and the existing housing obligation under the Housing Support Program. In order to make sure that people aren't adversely affected by the change in their spend down, the language in the SCS 4410A 132 amendment has been agreed to.
Madam Chair, move the A132.
All right, thank you, Senator Abler. All in favor of the amendment, please say aye.
Aye.
Aye. Any opposed? Motion prevails.
Madam Chair, the next item is from the offer sheet, line 155. This is correcting a budget activity mistake that occurred in the 2021 appropriation. So the amendment moves money from one budget activity to another. To accomplish this, the committee needs to adopt the SCS 4410A 85-1 amendment.
Madam Chair, I'll move the A85-1 amendment.
All right, that amendment is before us. Any questions? All in favor of the amendment, please say aye.
Aye.
Aye. Any opposed? The motion prevails.
Madam Chair, members, the next item was line 156 on the offer sheet. This was a carry forward of the fiscal year 2022 mental health grants to counties. In order for that money to carry forward, the committee needs to adopt the SCS 4410A94 amendment.
Is that the A98?
I'm sorry, 98 amendment.
That's okay. Madam Chair, I move the A98.
All right, so the SCS 4410A98 amendment is before us. All those in favor, please say aye.
Aye.
Any opposed? The motion prevails.
Madam Chair, members, this next item, if you're following along on the script, actually has a mistake. I will provide you with the correct motion. The offer sheet had an item on line 158, which was to continue funding for a grant to an Anoka County SUD provider. In order to continue that funding, the committee needs to adopt the SCS 4410A 137 amendment.
It's coming, Madam Chair. Thank you. Madam Chair, I'll move the A137.
Right, the A137 amendment is before us. All in favor, please say aye.
Aye.
Any opposed?
Madam Chair, I have a question for that.
Sure, Senator.
And on line 2.8 and 9, it says this paragraph does not expire. Does that mean that's an ongoing? Thank you very much. It's a really good program, Madam Chair. Thank you. Actually, it's just an amazing program.
Okay, Senator, did you actually get your question answered? Could we all hear what the question and the
Madam
answer?
Chair, I'm sorry. I nodded. The answer is yes, it's ongoing.
Okay.
Oh, yeah, thank you.
Thank you.
It's just a funny way to put it, but it's interesting.
Okay, thank you. And my understanding was that that was not new money, but authorization to continue.
That's correct, yeah.
The money to continue.
Just saves them reapplying since they're going to get it anyway.
Yes, thank you. Okay. Very good. So we have gone through our list of hashtag items and
Madam Chair,
yes.
is there any
Senator
point
Abler.
in just discussing the ones that it seems like each of us, a couple of us, we didn't like one of them. But is there any point just to exhaust that list? And I mean, like the Merck thing, did the Senate does want to do that? Not yet, okay. And so, Madam Chair, just can I ask a question? On line 157, was the House interested in that? The idea was that at the end of the biennium, unexpended money in that particular SILS grant would go to the MSILS. So otherwise it goes to the forecast.
So, Senator, I think right now we don't have, well, we could share the screen so that we know what we're talking about, I guess.
Oh. All right. I'm just,
So-
I'm talking about line 157. And so every year, there's a couple $1 million left at the end of the year, at the end of the biennium on this. And it drops to the bottom line. It's designed for independent living. So it occurred to me that if we could just let this residue be appropriated to the MSILs on an equal basis amongst the 8 of them, it would be a good way to keep the money captured for the purpose. There's no cost to it because that money is expected to be all spent in the forecast. And it's a kind of a free way to help the MSILs that are so useful. That was the idea. So you can think about it, but I thought it was a pretty good idea.
Oh, okay. Well, I think maybe that's one we should take under consideration. Were there others that since we had the spreadsheet on the screen here, were there others that you wanted to discuss? Or
Well,
that
Madam
other
Chair, it seemed
members
like
wanted
nobody
to
liked
discuss?
the governor's idea about clarifying enrollee error overpayments. I don't even know what that is. And the vaccines, we didn't do vaccines. I guess that's all there really is. So maybe if you just want to think about line 157, that would be great. Thank you, Madam
Okay.
Chair. I think
All
I'm done
right.
with the list.
Okay.
Just trying to
thank
get through
you.
all the easy stuff.
Okay.
And Madam Chair?
All right. Yeah.
There was an
Senator
amendment
Abler.
from last night from Senator Anderson. Did people do their research on the A74 about adding developmental disability to that list of the kind of needs a person might have to get those services or to get the custody?
This A74, Senator Abler?
Right, we talked about it last night a little bit. and-
Yeah, we can move that one.
Oh, thank you,
We're
Madam
okay
Chair.
with that one.
Madam Chair, I'll move the A74. Hooray.
Okay, and do members have that before them? I know what it is, but I don't know if that one was one we were
Including
expecting
two
to-
words, I believe, Chair
Yeah.
Lieberman, and our judiciary chair has okayed it.
Yeah, no, I know what it is. I just want to make sure that, since this is a public process and, that we actually have the amendment and
It
people.
was probably posted
are-
on last night's list.
Yeah, so Madam Chair, the amendment has just been sent to members and staff, and I'm going to post it on the website right now.
All right.
So I don't want to
Okay.
rush anybody, so we can wait, Madam Chair, if they want to look at it first.
Yeah, the A74.
You can move on to something else or.
Yeah,
pick
and
it up.
just for the record, I'm glad. I thought that
it's-
one seemed very reasonable.
It's a good idea.
Yep. Okay, so we could come back to that one. I just want to make sure that we're, keeping, hopefully, let me just look at
To the
my
front
list
line.
here of, I think we've gone through all of the, let's see, could I just ask the staff, there were a number of amendments that were just little clean up fiscal, things that didn't have fiscal impact. I think we did all of them. I'm pretty sure we have now. Okay, and so I think, so we've got the A74, it's been sent out and it's been posted, and it is a really brief, just a small amendment. So does someone want to move that then? Senator, did you want to move the A74? We could
Well,
take
Madam Chair,
that
I'll
up.
move the A74. That's really great. You can do that.
Okay, so it's sort of been described already, but do you want to just describe it, Senator, for the listening audience?
Yeah, I can happily do that. It's, has to do with the issue of custody and parenting time and the things the court has to consider. And I'm just surprised that they've never added a list, developmental disability. So it simply adds that to the list of things the court needs to consider that may require special services. Thanks,
Great.
Madam Chair.
All right. All right, the A74 is before us. And do we need let's see, is that the complete?
It's a freestanding amendment.
Yeah, we just want to be sure we get the whole code in here for the record.
Oh, yeah, okay.
Anybody
Sorry.
want to state the whole code? Because I don't
Want
have
the
it.
whole
in front
code?
of
I'll
me.
read you the whole code. It's the SCS 4410A74.
All right, all those in favor, please say aye.
Aye.
Any opposed? The motion prevails. The A74 is adopted. Okay, so I think there might be other amendments that folks might want to, kind of like I said at the beginning of this hearing, folks might want to bring up other amendments that are not actually agreed, but that might want to discuss, kind of the way Senator Abler just did with one of those things on the sheet. But
And Madam
I know
Chair,
there
we
are other members.
had the frontline worker discussion last night. Senator Utke has, I called him that again. Senator Utke has an amendment about that. I think it's what we want to do, but
Yeah.
he can talk for it.
Madam Chair, I'd
Yeah,
like to
Senator Utke.
offer the A139 amendment, and I believe that all got sent out here a while ago, so we'll make sure everybody's got a copy in front of them.
Yes.
Yeah, Madam Chair and Senator Radke, that did get sent, and it is posted on the website.
All right. Just if you would just, Senator Utke, give me a second here because I know we have a lot of numbers flying around, and I do know that I saw that one. So there it is. This is the 179 was what it was.
139.
Oh, 139. Beg your pardon. Okay. So. Okay. So this is the SCS 4410A139. Okay, Senator Radke, did you want to go ahead, please describe it?
Okay, thank you, Madam Chair. And members, we had some conversation last night about the family child care providers, their eligibility and getting them so that they could be part of the frontline worker payment plan or be able to participate in the 500 million that was set outside for that. And we've had conversations today to figure out how to do that because there was some discussion. Everything currently is going through the Department of Labor and Industry. With this particular group, the providers, it brought in the Department of Human Services. So the amendment before us just has the department identify all of the providers, notify the providers that they are eligible, and then or that they could fill out the form for eligibility and to be part of the funding, and that they contact and sign up through the Department of Labor and Industry, because they've got the process set up for taking the applications, verifying, and then sending out the checks. So that's what this amendment does. It brings those child care providers into the system, but yet because we're working with two different agencies, this is what will help, make that connection, and that the providers will know how to make that application and make them all aware that they are eligible for it.
Okay, Representative Pinto.
Thank you, Madam Chair. I appreciate the conversations I've been getting to have with Senator Utke about this. So the amendment that I see, it looks like the only difference with the one yesterday was just having DHS send out the notice and then receive payment for that. I don't know if, it seemed to me that the concerns that the agencies had, I should note that I've sent the amendment out for review to DHS and to DLI, and we'll want to get that review, but the only change from what we saw last night, which needs some technical work, was just adding that notice provision. So just as an example, if you have, I don't know how DLI verifies that the family child care providers, what their situation is, because they do that via UI, for example, UI status. Well, family child care providers don't necessarily don't go under that. Also concerned about there being a cost. I know Senator Utke and I have gone back and forth about that. So I guess I think this still needs some work. We need to have it be reviewed by those agencies. But I just want to reiterate, as we said yesterday, that that getting those child care providers who happen to be family child care providers, getting them these frontline worker payments is really important. So I want to continue working on that.
Great, thank you, Representative Pinto.
Madam Chair?
Senator Abler.
Yeah, and I hope we can resolve this tonight. This is a pretty big deal. We have a vehicle that's quite a sturdy one that's actually going to become law. So I believe it's the will of the committee, if I hear everybody, that we want to make sure we include these folks. So whatever discussions are going on with whatever agencies, Madam Chair, do you think that can be completed in time to wrap the bill up tonight?
Well, Senator Abler, I think the problem we have is that we believe that there's some funding that's going to be necessary to really accomplish this. First of all, let me say, we all share this goal. We all really, and I really appreciate Senator Utke working on this and his concern about this, because we absolutely all want this to happen. It's just that we're understanding that there's some difficulty just operationalizing this, and we absolutely want to get it out the door and done as soon as possible, but we also want to make sure that it actually works when it goes out the door and gets done.
Sure.
So we're still working on that piece, and we're hoping it's still being worked on. We're hoping that we believe some funding is going to be necessary, so we're hoping to put it in the fiscal bill. So with the funding that's necessary to do it, because there's some complications opening up the pool, and I don't understand the whole thing, but there are complications. So, and maybe, so that's our concern about it. So I don't think that our side is ready to adopt it, even though we wish we were in such a position, but we don't think we are. The worst thing to do would be to disappoint these people by saying we passed something again and then having it not work.
Madam Chair?
Yeah, I don't know who's speaking.
This is Senator Utke.
Oh, I'm sorry, Senator Utke, please.
Not a problem. Do we have anybody on from the Department of Human Services at this point that would like to weigh in? And I will add a comment before anybody does jump on. And when we do talk about and discuss funding, the way this is set up is the department just notifies the providers. The providers are people they're in contact with all the time, anyhow. So that I don't see where there really should need to be any additional cost, and I would like to hear from them because
Yeah.
they are notifying the people they work with, whether it's daily, weekly, or monthly basis, just to inform them that this is the process to sign up and be, fill out your application. So I think it should be pretty seamless, but I would like confirmation on that.
Yeah. Just to be clear, Senator Radke, I'm not saying the department needs funding for department operations around this. We're really concerned about the money that goes to the people. So it's not, but let me call on Chair Pinto and see if he can help clear it up to Representative Pinto.
Thank you, Madam Chair. Well, I think a couple things. I mean, one thing is Senator Radke had asked for input from DHS, but really the way the amendment's structured, it's really much more expectation of DOLI, right, of DLI. And so that's really where this is where it gets complicated because in fact, the way the amendment is structured is we'd be expecting DLI to be doing most of the work with DHS just sending out notice. So in terms of just getting input, we really need that from those couple different agencies. So we'll have to see how the cost works. And I know from talking with Senator Radke, there's concerns on the Senate side about that. And I think we need to talk that through. But I think from our perspective, it does seem like there is that from the administration's perspective too. And so that's my concern with, essentially that we're at a point where we can't say right now, we know that this is actually going to work. But we want to make sure that it does. So just a couple comments there. But we'd probably, in addition to getting input from DHS, we'd probably need more input from DLI, if that makes sense.
Yeah, would that be okay, Senator? I mean, we can certainly ask DHS to comment if they can. There's certainly no problem with that. I see Mr. Burdick is here. Mr. Burdick, did you want to try to address Senator Radke's question?
Thank you, Madam Chair. For the record, Matt Burdick with the Department of Human Services. I unfortunately don't have much more to add to the conversation than what's been said. It is correct that on behalf of my colleagues at DLI, I understand they still have some operational concerns as well as the concerns about taking from the available pool of funding that's available to other frontline workers, while also trying to make sure that we get funding out to this important group who were serving on the front lines during the pandemic. So I think we are committed to working together with the legislature and with our partners at other state agencies to resolve this problem that I think we all agree we want to get resolved. So I am, as I said last night, I am not an expert on the technical workings of the Department of Labor and Industry, so I apologize I can't offer much insight on that tonight.
Senator Radke, anything further on that?
Madam Chair.
Representative Albright?
Madam Chair, I'm a little confused, and I don't claim to know this amendment too clearly, but it seems that the conversation is talking about whether or not the Department of Human Services is going to have the wherewithal to complete the task. But in the amendment itself, it says that the Commissioner of Labor and Industry is going to transfer money to DHS for the purpose of notification. So I don't know that the language could be any clearer in terms of whether or not the funding is going to be available.
Yeah.
If that's not the question, please apologize in advance, but it doesn't seem like it seems like it's being provided for already.
Yeah, Representative Albright, and I'll call on Chair Pinto in a sec, but Representative Albright, I can understand why you'd be confused, but I don't think the concern is not about what it will cost DHS to notify people. The concern is that the money to be available to the frontline workers has to come out of somewhere, and the concern is whether it can all now go back and get it from that original pool, and that because of the way DOLI works, because of the way the pool works, whether the money can just be, you can just put in more people right now. And so it's about whether the money for these deserving folks is going to be available to them through this mechanism. That's the concern. It's not about getting DHS enough money to do its job in this transaction. That's not the concern. So that's why DHS can't really answer the question. It has to do with DOLI's operations and what they have to do to pull the money for these folks out of the pool after the fact when they're not in the original calculation. At least that's how I understand it. Chair Pinto, do you want to address that?
Yeah,
I probably said wrong stuff.
No, yeah, no, this is it kind of shows how complicated and confusing this is. So just to confirm, the issue is not getting notice about it. DHS can send notice out to family child care about various things, including this. So that's simple enough. The issue is the amendment we reviewed last night is identical to the amendment we're seeing now with this addition about the notice. And the amendment last night had technical challenges and problems. We're hearing about DLI, et cetera. And so the complicating factor is not getting notice out. It's true that there's funds in the amendment for that. The complicating factor is integrating this particular pool of individuals who are not employees. They are childcare providers who are in a different role, and the structure of the current system doesn't fit that well. And so what we want to do is make sure that we're getting funds to them and doing so effectively. And so that's the challenge. So as I say, I forwarded the amendment to those agencies for review. It's our understanding there is a cost, which then brings it into those complexities as well. But hopefully that clears up Representative Albright's question, at least about the language of the amendment.
Thank you, Chair Pinto. Senator Utke.
Yeah, thank you, Madam Chair. And just to clarify, I see this as we're adding the child care work providers into this program, and that they would be expected to get paid or draw the money out of the $500 million that's already been appropriated. Is that how you and your colleagues see it, or do you see that you're looking to another source of money to provide these payments?
And thank you, Madam Chair. So Senator Utke, what we're trying to do is to give these childcare providers funds, frontline worker payments, bonus payments, right? The challenge is to figure out the precise mechanism to do that. So my understanding in talking to the agencies is that doing so through the current mechanism and simply having the change that you're proposing would not be an effective way to do that, that there are challenges to doing it that way. And so that in that case, in fact, the better way to do it in the way that they've been proposing is to have the funds go out through DHS, and that there is a cost there. But I have to say, right, we're trying to figure it out because it is complicated, because the current mechanisms are set up for a particular situation. Part of the reason that we have this challenge is that the current structure was designed for employees, and these people are not employees. So that's the challenge. So it seems like the direction we're going is, and that would make more sense, is to have it be going through DHS and need to be this additional payments, but we're figuring that out.
So just to be clear, you're looking to appropriate additional funds for this payment structure versus using the $500 million.
Chair Pinto.
Thank you, Madam Chair. And Senator Utke, it seems like that is going to be the better and more necessary way to go. I know that you and I had discussions earlier today about that, and I understand that there's concerns about that. So we're trying to figure that out. But yes, that seems to be the direction that's going to make the most sense from our perspective. And I know you may have a different perspective, and that's what we're trying to figure out.
Madam Chair.
Senator Utke.
Yeah, and I guess, thank you, Representative Pinto, we do have a difference of opinion or how we're going to get this. I think the end goal is the same. We're working with the same pool of people and want to take care of them. But, again, we're sitting here, we've got this evening to get it taken care of or figure a path to the finish line. So I guess if others could help us get, whether it's somebody from the Department of Labor and Industry or somebody to weigh in on this, because we need to know how we can do this, because with this amendment, we feel we've got the mechanism to do it. But if there's a better way, we're willing to listen, but I think we do want to wrap it up.
Agreed. We all want to wrap it up, Senator Utke. On that, we can really agree. Yes.
Madam
Chair
Chair.
Pinto. Oh, I'm sorry.
Yeah,
Chair
Abler.
Pinto, go ahead, and then,
Oh, yeah, fine.
and then we'll go to Abler.
Thank you so much, Madam Chair. And Senator Utke, and I'll just note, DHS had provided a path from their perspective, and I guess and Dolly had as well, as a way to do this. It would involve an additional cost, which I know is a concern to the Senate, and so we're trying to sort that through. I think that's one of the reasons that I was thinking it was going to be pretty tough to do this tonight, because even if we figure it out, it seems like the Our thinking is there probably is an additional cost, in which case that, of course, would have to be in a fiscal bill. I know that's not something the Senate wants to do, and that's why we're trying to sort that out. But that's right now the path that the administration at least is suggesting would involve going through DHS, as we had talked about earlier today. So happy to continue. Maybe when we hit a recess, we can kind of talk through and see what we can figure out. But right now, that seems to be the path that we'd be going on, is to having additional costs from our perspective. And then, of course, that's not something we could do tonight.
Okay, Senator Abler.
Thank you, Madam Chair, and I think we're kind of coming in for a landing here, but, you know, I got a call from the commissioner a week ago or something and said, hey, I got to tell you something. I'm like, what? And so I don't think it's her fault. She's just a messenger, but I think it's really disappointing that once again, the licensed homes wind up being on the place that people ignore. You know, there's a great deal of interest in this conference for childcare, and which seems to be synonymous in many cases with a center, and many people use this center, but there's more centers open than there were before COVID, and there's 4,000 less homes around, I don't know what period of time, but that's could be 40,000 slots or more. And they're all over the place, and my own grandson goes to one, and it's just remarkable. But so, and nothing against the centers. I mean, they're all, we need them all. We have put hundreds of millions of dollars out to make sure that they're as intact as they are. And I think the success, the fact that there's still so many centers around is a really good thing. But the fact that there's so few homes remaining is a problem. And here again, they have been somehow left out. And I'm not aspiring, or I'm not pointing blame. I couldn't think of the right word there. But I don't know who to blame, and it doesn't matter. But there's no way that this group of worthy workers who have been on the very front line as much as any other frontline person, with any number of unknown kids, or what they come in with and everything. And so I don't think they should have been left off the list in the first place, Madam Chair. And so it's too bad that someone's going to try to put the money on this committee with all the pressures we have on our budget and the challenges we have, that someone's going to, because of a clerical error, we got to spend $3 million. That just, and I appreciate the tone that everybody wants to fix this, so I hope we can get there. But I just was chagrined when I got that news. So thank you, Madam Chair. I'm done.
Well, Senator Abler, we all share that. We absolutely do. Chair Pinto, final word on this topic, and then probably we should move on. I don't know if Senator Utke will want to withdraw his amendment, but go ahead.
Thank you, Madam Chair. I should have noted earlier that going this route of having it be through Dolly, et cetera, one thing we have heard is that would significantly delay the other payments that are going to go out. That's just one piece, because they are several weeks into building the system, and it would delay that because it's a different structure. But I agree with you, Madam Chair, and support Senator Abler's comments that family child care is absolutely critical, and we're very supportive and want to make sure that we address this and do, frankly, a lot of other things for family child care and all child care. So thanks, Madam Chair.
Yeah, thank you. Senator Utke, did you want to withdraw I don't know, did you officially move it? I think you did. So do you want to withdraw it, or?
Madam Chair, yes, I did move it, and I'll just add one brief comment, then I'll withdraw it so we can bring it back up later as we figure out what we're going to do. But the way of separating these payments also looked like the child care providers were going to be, it was a lesser payment that was being planned for them. And I think in all fairness and all equality and everything across the board, the way that we have to approach this is to get them into the same pool of money, treat them all equally, and hopefully there's enough there to go around and help them all out and give them a nice a little bonus. So, but with that, for right now, I will withdraw the A139, and we can work on it here over the next little while and see if we can get this figured out.
All right, thank you, Senator. All right, good discussion, folks.
Madam Chair.
Yes, Senator.
I have the A111 amendment, which is the balance of the Sunset Cluster. And just looking for some advice, you know, we want no harm to happen from any of this, and even in a year, how's it going to go? It'd be nice if the department could at least commit to us that they'll let us know what they've heard, or maybe we should ask the ombudsman to, you know, we might need some language to ask him to just report on complaints they've gotten or something. And so in the break, I'm just kind of curious if you want to do something like that. But I'll move the A111 right now, which will take care of the Sunset. But looking for advice on how we can see how it went. Maybe it's going to be amazing, and maybe they're so careful and everybody's opted in to want to do it, and they think, yeah, this is just fine. so it can be something we can continue. So we're going to, next year, we're going to be, some of us, all of us, I don't know, who are going to be in the same room talking about, should we continue this or not? So it'd be nice to know how. But for now, we'll just do the sunset, Madam Chair, and maybe take the
All
rest of it
right.
tonight.
Thank you, Senator Abler. So I think we need a little help from staff on how to do this. And is that, Mr. Monahan, are you prepared to help us step through this?
Madam Chair, members, I think you need to reconsider the motion by which Senate Article 8, Section 11 was adopted to begin with.
Okay, or, yeah, I'm sorry if I called on, you know what, staff, if I call on the wrong one of you, just feel free to tell me it's somebody else if you're not prepared with that answer. We don't expect all of you to know everything at every moment, even though we know you know a lot. So, all right, so we need a motion to reconsider Senate Article 8, Section 11 as amended. Does someone care to
So
move that?
moved, Madam Chair.
All right, Senator Abler. So all in favor of that motion, please say aye.
Aye.
Any opposed? The motion prevails. Then we need to.
Madam
Ms.
Chair, I'll move the
Pinelli?
A111.
Okay, all right. Senator Abler is moving the A111 amendment, and is that, let's see, I think I have it here. And just so so it's the S4410 A111 amendment. So, and does everybody have that, and have you had an opportunity to? Okay.
Posted.
Yes, Madam
Very
Chair, it's
good.
been posted.
All right, so all in favor of adoption of that amendment, please say aye.
Aye.
Any opposed? The motion prevails.
Madam Chair.
And then
Madam Chair.
Senator Abler.
I can move the A134-1, that's the question. And the
We need to move
confusing,
to- we
I
need
mean, that
to
was the,
adopt the Article 8, Section 11.
oh, we have to, oh, I'm sorry,
We
never
need to
mind.
move that.
I'm ahead of you.
Okay. Yeah, you're head of the staff. Let's
All
let
right.
the staff tell us what we should be doing here.
That's a great
Ms.
idea, Madam
Punelli
Chair.
or Ms. Punelli, maybe you want to continue. Let's see.
Madam Chair, I believe the motion would be to move Senate Article 8, Section 11 as amended.
Madam Chair, so moved.
All right, so that motion is before us. All in favor, please say aye.
Aye.
Any opposed? The motion prevails. Okay,
Madam Chair,
yeah.
at the risk of
Senator
flailing arms again, I move the A34-1, that's the 70%, 83% question. And so the news is that between September 1st and September 30th, people apply. They send in all the information. If it's not there by September 30th or whatever, they don't get to be in. So that was a helpful clarification, and I want to thank everybody who's spent the time on this. This is going to make a good difference in this important program. So thanks, Madam Chair.
All right, well, Senator, the amendment you're moving is the A34?
A134-1.
A134-1. I just want to make sure we all know what we're working
Yeah,
on here.
I'm fine with that amendment, Chairman.
Okay, and that one
Yeah.
had been distributed. Mr. McCullough?
Yep, Madam Chair, that was actually listed on the script. We're actually kind of going back to the script.
Okay, thank
This
you.
was the
Thank you.
question about
Got
the
it.
date, so the date's fine.
Yes,
We
okay,
need to
got
make-
it. This is the one we skipped so that some questions could be answered. Okay. So Senator Abler is moving the A134-1 that we discussed previously. Okay, all in favor of that motion, please say aye.
Aye.
Any opposed? The motion prevails. Okay. And so I understand that we have at the A142 that Mr. Albrecht is.
Madam Chair, you adopted the amendment, but you didn't move the section as amended.
Oh, thank you.
Madam
Okay,
Chair, if
so-
staff could tell me the motion I should make, I'd be happy to make it.
Move Senate Article 2, Section 16 as amended.
Madam Chair, so moved.
All right. All in favor of that motion, please say aye.
Aye.
Any opposed? The motion prevails.
Thanks again to our crack staff.
There you go. See that? We would have goofed that one up for sure. All right. Okay, so did Mr. Albrecht want to, I think we had another pause, right? On another item that we need to return to?
Madam Chair? That would be the
Mr. Albrecht.
A142 amendment.
Okay, and let's see, the A142.
Madam Chair, that's also been posted and
Okay, that's been,
sent
and
out to
that,
the members over
okay.
email.
All right. And Senator Abler, did you want?
Oh, so Madam Chair,
that?
I'll move that.
All right. So the A142 is before us. Could staff just remind us of what that is?
Madam Chair and members, this is going back to House Article 18, Senate Article 10. And this is the provision that relates to the the provider repair and improvement grants. And the A142 dedicates the 24 and 25 fiscal year 2024 and 25 appropriations for the grants under 256K.45 subdivision 8, which is something you adopted, I believe, last night.
Okay. So Mr. Albrecht, do we need to, so we can just adopt this and it replaces, or it amends what we did last night then?
Madam Chair, it goes with what you did last night.
Okay. All right. So Senator Abler, you already moved that amendment. So that was the A142. So everybody prepared to vote? Okay. All in favor of that amendment, please say aye.
Aye.
Any opposed? The motion prevails. All
Madam
right.
Chair.
Senator Abler.
In the Department of avoiding future work, I just got a text back from the department on that 6-bed business and the 7th and 8th beds at the ICFs. DHS plans to monitor how that's working. So, and just who's ever sitting in one of these chairs would actually appreciate a heads up on how that seems to be working. And so if you were a part of that and see a problem, let DHS know. And the Department of Health did not reply, but I presume they'll be monitoring the 7th and 8th beds in the ICFs, and they'll have a very finite list of who they were. So, so thanks for everybody working to try this, at least as a temporary thing. That's all, Madam Chair. So we won't need a report back. Thank you.
All right. Right. Thank you, Senator Abler, for
And
that.
Madam Chair, I have one question for you.
Okay, we
on
do
an
have.
area that didn't get adopted, and I was not part of the discussions. And so on the overnight, the variance for alternate overnight supervision in Senate Article 6 and Sections 1 and 2, I thought that was a pretty good section. I wasn't part of the discussions about how it's sitting not adopted. But Madam Chair, it seems like it's a really good feature that would help a lot of these facilities to truly do better care and not need extra beds and try to preserve the staff we have. So we were pretty strong on it here. Did you have a concern about that?
Senator Abler, this isn't something I know about, so I don't know if Chair Schultz
Oh, maybe I'm asking the wrong.
has comments on that, or if maybe if you want
Because
to.
we never discussed it with
Senator
Representative Schultz
Abler,
and I.
can you refer to the article?
Yeah,
Senate
it's
Article
a standalone article at the end of the pile. It's Senate Article 6. It's a Senate-only article, and it's called Operations and Licensing, and it's Sections 1 and 2. And if you're not familiar with it, I'm happy just to let you look at it. We can take it offline. I just thought maybe it wasn't something that the House accepted, so. But maybe they never even thought about it.
Yeah. Yeah, you know, Senator, there's a lot in this bill and right on both sides. And it is good to bring up something that might have been overlooked. So.
Okay, well, thank you, Madam
for
Chair. So
that.
maybe
You
in the
know,
break, we
let's-
can look at that.
Yeah,
Okay.
let's, so I think we had possibly a couple of the things that members wanted to, maybe other amendments that were, people want to offer. I don't know, I'll just see if think we finished our list of agreed items here. Are there amendments that members want to bring up for discussion? Representative Gomez.
Yeah, thank you, Madam Chair. So we haven't, as the chair mentioned at the beginning of our time today, we're maybe going to bring up a couple items. This is one of those that we just haven't really had a chance to chat about. And so just kind of genuinely wondering where you guys are at. It's a provision from Representative Freiberg. So it's the tribal cannabis language, which is House Article 1, sections 76, 78 through 80, and 83 to 88. And then there is a minor cost to it, but MDH can manage the cost out of an existing IT fund. So we have the A106 amendment, which just outlines basically like any costs the department will absorb. So I'm not sure how you'd like me to proceed. Madam Chair, I can just kind of talk about
I think it would be good for you to just briefly describe kind of what the idea is here and, see if folks have concerns.
Okay, thank you. So tribes, sovereign governments in Minnesota can create their own medical cannabis programs to operate within the boundaries of their reservations. But there can be complications, for instance, for patients who access their medicine through a tribal dispensary and then leave tribal lands could be held liable for violating the laws of Minnesota, even though they are like any medical cannabis patient that accesses their medicine from a dispensary that's allowed under state law. So it will just ensure that patients are treated equitably, wherever they're getting this medicine, and that the programs won't kind of run afoul of any Minnesota laws. So the Red Lake and White Earth Nations are in the process of creating medical programs. This language would, is open to any tribe. It's not specific to those tribes, although those were the nations that were sort of worked with with MDH and other stakeholders over the last year or so to develop this language. It was discussed in Health, Finance, and Policy over the last year. So it just kind of spells out how tribal medical cannabis programs will operate when Minnesota laws apply. And also, we have testing requirements in the medical program. So it allows tribal medical cannabis programs to transport medical cannabis to a testing facility or a laboratory within the state under certain conditions. So that's what I am putting out there. I don't know if anybody else has thoughts on it.
Madam Chair?
Yeah, Senator Upke.
Okay, thank you, Madam Chair. And honestly, I was working on some stuff here, so I don't know exactly the section, but really the only point I want to make is on the Senate side, we did not hear any of these things. There's a lot more that has to go into it before we can make any quick spur-of-the-moment changes to the medical cannabis. There's been a lot of people that have had a lot of interest in it, and the more I dig into it, the more questions I have, the more concerns we have, and at this point, it's just not something we can do right now and support. I have agreed to look at it further. It's going to be another year, but I just can't support that.
Okay, so that's really unfortunate because I think at least in the House, a lot of work has been done. This went through a lot of committees. This is something that our tribes, our sovereign nations are able to do themselves, and they are asking for a partnership with Minnesota to make this more functional for their members is all it is. And I think, and Chair Gomez is, because, right now we're doing items that are not fiscal items, that's what the amendment is just essentially takes out the cost so that this could be a policy only item. And It's not a big change, Senator Utke. It doesn't open up, it really just allows the tribes to, my understanding, please Chair Gomez if I misstate it, but it really just allows the tribes to sort of, have their patients be treated the same as other patients in the state. Whereas right now they're not, just as kind of a loophole in the law is all, and just the way these programs came about. So that's really all it is. I mean, if you could take a look at it, we would really appreciate it because it impacts patients. And, it gives, we don't want to put stumbling blocks in the way of patients just for no reason. Then it's kind of, it's just sort of a bureaucratic reason right now why this isn't in place. It's just kind of the law just didn't grow up the right way around this. So if you could take a look at it, and it could be a no-cost item that we could, take care of for some folks and just get some barriers out of the way, that would be a great thing. So
Madam
thank you
Chair.
for considering that. Yeah, Senator.
And
Abler.
just practically, and Representative Gomez, I probably am sympathetic to this personally, but I know we have to get a bill that kind of reflects our caucus, as you have to get a bill back that reflects yours as best we all can. I do know within our group there's a significant amount of concern about this. And and because of that, even though I might be open to it, I would vote no today. And I don't believe it's going to pass. So I think the advice to you, Representative Gomez, is to do some outreach to across the street over here and see if you can, get people to be interested in this. It's unfortunate with COVID how separated we are, but sometimes even simple conversations can go a long way. So I really don't want to vote no, but I encourage you to keep working at it. So is that okay, Madam? I just want to say that.
Yeah, absolutely. Chair Gomez, do you want to say any more on this?
Yeah, no, I mean, I do, I appreciate the consideration. I did reach out a couple times to folks, but I didn't really get much of a response. And I know that, that some of the tribal communities have been working on this language, and Representative Freiberg, Chair Freiberg, have also reached out. So looking forward to more conversation, and I hope that we can get to an agreement on this because, as the chair said, it's really just about, treating patients equitably and making sure that something that the tribes are allowed to do because they're sovereign nations doesn't, intersect badly with if they leave those territories. So yeah, it sounds like we're not going to be able to get agreement on this, unfortunately, today, but looking forward to more conversation. I know that I'm open to it, as is Chair Freiberg and the representatives of our sovereign nations that share a geography here. So thank you.
Yeah, thank you, Chair Gomez. And I just do want to say, Senator Abler, that even in person, it can be very hard. Honestly, I feel like I've been more able to get a hold of you and we've been able to talk more remotely. Sometimes just because you're in close physical proximity doesn't mean you're able to get a conversation. And I think that Chair Gomez has tried, and we've all got busy schedules. We're all juggling a lot of things, but I know that members have really been working hard to get a hold of each other to have these conversations, I'm sure going both ways. So I don't think it's, for any lack of attempting to have the conversations, but, obviously we're not going to agree on this one today. So I think we should probably move on.
Sure.
Sorry, I'm having trouble hearing you.
All right, that's because my speaker was off. Representative Schultz sent me a text that overnight matter has a cost. So anyway, when we get to the money, I think it has merit. And so now I know why it's not included in the policy thing. So very nice. Thank you.
Yep. Thank you. And was there anything else that members wanted to bring up before
Madam
we
Chair?
take a break? Who's speaking? I'm sorry.
Madam Chair, Senator Utke.
Oh, Senator Utke, thanks. You know why I'm confused is because I get the little light in one square when you're speaking in a different square, but go ahead, please.
No problem. Thank you, Madam Chair. I would like to offer, I'm taking a section that's currently in our books and bring it into our policy section, and that is under, okay, on your tab, it's under Article 9, and it would be, and then I'm on the Senate side, and I'm on section 43. So it's House Article 9, but then the Senate Article 1, section 43.
Just give me a second, I'll find that. Do you know which, if you're on the side by side, do you have the R?
Oh, it's page, it's R58 is the page it starts on, it's section 43, and then
Madam Chair, this also has this cost item.
okay, I would like to speak to it when I get a chance.
Okay, well,
Once,
so-
we'll let everybody get it, let everybody find it first.
Yep, yep. I have it. I don't know if others have been able to
Okay.
locate that, but okay, I mean.
If everybody's.
All
re-
right.
if
Sure,
they're
Senator, go
ready,
ahead.
I'm moving this one for consideration because what it is, it's a sub-minimum wage task force. Yes, it does have a cost. We've had it on our offers each time for, I believe it's a total of $95,000. And that was because the study group was going from 16 members to 20. It also includes the policy language that eliminates the word eliminate and goes more after what we guess we'd all hope the task force would do. And the reason I bring this forward at this time is we just adopted the A93 amendment, which had a governor's advisory council included, 18 members, and last night the Department of Human Services said we're going to cover the cost. I'm going to ask them to cover the cost for these 4 additional members so we can make this work. And I'll take input from them if they want to weigh in.
I would like to speak to this,
All
Chair
right.
Liebling.
Representative Schultz.
Thank you. Well, thank you, Senator Uckey. I think we share both wanting to add members to the task force. That we brought the amendment forward similar to this last night, and we adopted it into the House language, and Senator Benson had concerns about the LCC appointing the members. So we have a new amendment to have the appointments be made by the Speaker of the House and the Majority Leader in the Senate, and adding those members to the task force. So we could also bring that amendment forward if you would like.
Yeah, I did get a call from Ms. Grom from the DHS this morning, talking about the difference in the way of appointing the members. It was a more timely function, but I guess I'm interested in the membership change, but I'm also including the fact that we need to make the policy changes too, so that we aren't talking about eliminating the sub-minimum wage. We're going to study it. We're going to look at it. Is there things that can be improved or whatever? But I'm here to support the 6,000, 7,000 Minnesotans who get up every day and go to work at that type of job and love their job. They love their friends. They love everything they do. And this current language that got inserted at the last minute last year is threatening their livelihood. It's threatening what they get up in the morning to do. And so that's why I brought this forward, and I'm including the fact that DHS can step up to the plate too and help us out, because it would be doing the right thing.
Yeah, Senator Uckey, Chair Liebling.
Go ahead.
Yes, I share your concerns, but we do possibly have federal change coming, and I think the intent of the task force was to just study it, what happens when we have to be compliant with federal law. And so this task force is studying that. I agree that we should add members so there's more people at the table. I think we share that concern. And I think maybe we could work offline a little bit on the other language. The task force, I believe, has been meeting since February 8th, and it is only giving advice to the body, to the legislative body, on their findings if federal compliance, if we have to be federally compliant, if the federal law changes about not disallowing us to pay sub-minimum wage. So that is, I think, why the task force was formed. But if you, we might not be able to get this resolved tonight, but I'm happy to work with you, Senator Uckey, on language around that. But we could definitely adopt I mean, I'm happy to adopt the amendment to appoint those members, and that could, if we do that tonight and get it into the policy bill, that might happen faster if we could do that sooner rather than later.
Okay, well, so the amendment that's before us is Senator Utke's amendment, though. And I guess my question to Senator Utke, I think, did you make a formal, did you move the
Yes,
section, Senator?
I moved that section, which is Senate Article 1, or Senate Article 1, Section 43.
Okay, so Senator, I guess what I would say is that this is really controversial, and I have gotten a lot of pushback on it. And if you were going to go to a vote tonight on this, I don't think it's going to pass. So what I would say is, I appreciate your passion on this, and I must say there's a lot of passion around this from a lot of folks. I mean, I've been getting a lot of messages, and there's a lot of, this is a very controversial topic, but I don't think we're going to be able to adopt your amendment tonight. I don't know if you'd be open to just doing the part that Chair Schultz was talking about or not, but maybe you and she would want to talk some more about it. But, in our opinion, for one thing, this is a fiscal item. And the other one that you mentioned that didn't have a cost on the spreadsheet, that was because it's already in fact being done, and it's just being codified, something that's already being done, the A93 amendment. But this one is a little different, and so we could certainly continue discussing this, but I don't think it's going to pass tonight if you were going to ask for a vote on it.
Well, I fully disagree with comments from Representative Schultz and you, Madam Chair, and the fact that you bring up the federal part of it. We've heard that. I've also heard that, it could be anywhere from bogus to way down the road. I don't care. The fact is, the language that was passed last year and inserted in the dark of night, as we could say, or whatever, it was last minute. It has the part in there about the elimination of those jobs. So by not considering this, we're saying their jobs don't count. We don't care about what they do. And the other thing, now I just did, shoot, that would fly in out the back door. I guess I forgot. But anyhow, a senior moment. But anyhow, the fact is we care about their jobs. And, I know, with the current language, everything is set up to be an elimination. And the people that applied for those spots to be in that group had to, when they filled out the application, they went online, and the department said you had to agree with eliminating sub-minimum wage. If they didn't agree with it and wanted to get on there, they had to lie. I mean, this whole thing has been so one-sided. The way this language is, it still brings the group together. They get to discuss it. It just takes out that part that says we're going to eliminate these jobs. And that's the part I'm after. The study group still goes forward, comes back with a recommendation. What can we do better? How can we do this or that? But we've got to get rid of that term eliminate, because I, for one, and many others, want to give those people the opportunity to do their jobs that they so dearly love to do, and we're telling them their jobs don't count. And that's exactly what we're doing if we don't go forward with this. And so that's why I moved it here tonight, and I would like it to be considered, because I just don't think it's fair to them. It wasn't fair to them when it got passed. But anyhow, that's where I'm at.
All right, so my staff told me that they didn't think that it had been completely moved. So you might want to maybe restate. Let's restate if you want to have a vote on it, Senator, let's restate the motion so that we're sure we got it correct at least. And let's, can staff help with that, just so we make sure we get the correct motion?
Madam Chair, I could help if you'd like.
Please.
I believe the motion would be under House Article 9, moves Senate Article 1, Section 43.
Okay, all right, so that's been moved. All right, so all those in favor of the motion, please say aye.
Senator, aye.
All opposed? No,
No.
I don't think the motion prevailed. So the motion did not prevail.
Can I just clarify some comments from Senator Aki? Charlie?
Sure,
Or do you
go
want-
ahead.
Or do we need to move forward?
Well, I mean, I think we are close to being maybe done here and ready to take a pause. So if you just want a moment, Representative Schultz, go ahead.
Thank you, Chair Liebling. I just want to comment that, we care about everyone in this state. We care that they have jobs. We care about fairness. We care that we do things that comply to federal law. And we also want to investigate, and we put money in to giving money, grant money to providers who wanted to transition away from paying sub-minimum wage. So many other states have done that and they haven't lost jobs. So this was just we felt was an opportunity to give providers who wanted to transition away and attract higher paying jobs for individuals. This was their opportunity to do that. So there was federal funding tied to those who voluntarily wanted to team up with providers who have already eliminated sub-minimum wage jobs and were paying higher wages. This was their opportunity. So these are just recommendations. I just want the public to know. Recommendations to the legislative body. Nothing is being eliminated. No jobs are being eliminated at all. These are just recommendations as if we had to transition away, how would that work if, for instance, something did happen at the federal level? Or, I think we're hearing that something could happen. It's a possibility. I think Minnesotans just want to be prepared for that. And that's what this task force is doing. But Senator Aki, I'm very happy to work with you on that language and we can look at the cost again and work with DHS on this. But we are definitely agreeing that we want to add members to the task force.
All right. Thank you, Chair Schultz. So are there other amendments that members wanted to bring forward or items for discussion here before we take a break? I feel like I should be an auctioneer and going once, going twice. We've had some good discussion here, which I really appreciate.
So, Madam Chair, I think for my part, I think I've exhausted everything I have that's open except maybe that one Article 157. But so when we're going to recess, could you give us a half-hour heads up, do you think?
Yeah,
you think
absolutely.
It's going to be well? Okay.
Well, Senator, I think that, first of all, during the break, I think that we would ask our nonpartisan staff to please, review what we've done here, make sure that you don't identify any oversights or, things that need to be corrected. If you would do that, please. And of course, they do that all the time, whether I ask them to or not. I think also, Senator Abeler, we need to talk together, or a few of us need to just talk about process and, where we go from here. So I would, rather than having us go off to different corners and take a break and then just telling you we're coming back, I'd like to be talking to you for a little bit when we take a break here. So
we could do that.
Maybe
sure.
we could jump on another Zoom and just chat together.
All right,
about a few things, maybe with a couple of
I have
staff.
one of these things, I don't know, I could just call you.
Yeah, that's true, but it would be helpful. I think we need to, make sure we have at least a little bit of staff because we need to,
Sure.
sometimes I get things wrong. I know you don't believe that, but sometimes
What?
I hear something and I'm like
Madam
trying to tell
Chair,
people,
don't
and I
say that.
So I want to make sure I get it right, and that's why we have all this wonderful staff that we have. So anything else that So I don't think it's going to be a long break. I certainly do not want us going, I hope we're not going to go till midnight.
Well, Madam
again.
Chair,
Yeah.
is there some
Senator
chance
Abler.
that somebody could reconcile this frontline worker thing to our satisfaction tonight, at least to make us comfortable that we're not the right place to put it? I think that's something, this is actually, this vessel is going to make it across to the promised land. And so if we can figure out, I don't know who's deciding this. I don't know, the $3 million seems unfair. If that's the administration's position, I guess it is, but it doesn't, it seems like it's a clerical error that they should have been part of the pool and they'll dilute it minimally. And I just can't see why they can't be part of the whole deal, but it would be nice if that could be reconciled. So if someone can work on that to figure out if indeed this is not the place, then what is the place? Because we do have to get done tonight. If it's tomorrow, this place is probably the wrong place for it. But Madam Chair, I don't know who's going to work on that, but.
Yeah, Chair Pinto.
Thank you, Madam Chair, and thanks, Senator Abler. So yeah, no, I'm working on that. I think it's pretty unlikely. The only way it happens tonight is if we can both work out the technical issues and have it be that it's not something where there's an additional cost. And I'll just say that my understanding from the administration is that their strong feeling is that it does have to happen through DHS and that there is an additional cost. I'm pushing and working and had a meeting earlier today with Senator Udke. And I'm going to continue working on that in the next couple hours, Senator Abler. And we'll continue to pass time too. But just in terms of how realistic that is, I guess we'll have to see, right? But it seems pretty tough.
And Madam Chair, and just
Yes.
my final thought, it's just, I've heard from a few of the childcare licensed workers of the family, whatever, the licensed childcare people. And this is very discouraging for them. They were on the ropes, and the session can't end without this actually becoming law with the fix, whatever it's going to be. So I'll leave it at that. And I know we're all committed to that, Madam Chair. Thank you.
We are indeed, Senator. And, I keep thinking about the child care provider, the family home child care provider who took care of my kids when they were little. These are great people. These are wonderful settings. These are, we need them. We want to do right by them. They are great. They stuck in there with us, with our kids. There is no intent to do anything to these wonderful people. And we're going to do everything we can to make sure that they get what they deserve as well. So I really appreciate Chair Pinto's work on that. So.
Thank
All
you,
right,
Madam.
anything else, staff, or anyone who needs to weigh in here before we take a recess? And we will give everyone notice, and we will try to make it be as brief as we can, so that we can get this policy part of our bill wrapped up tonight.
Madam Chair, there are well over 200 people at home glued to their TV sets. And so this is, Madam Chair, we are breaking every record, and in the room there must be nearly 300 people. It's amazing, and some of the finest people in the industry, Madam Chair. Thank you.
Yeah, okay, all right. Well, on that note then, thank you everyone for your rapt attendance and attention, and we will look forward to seeing you back when we resume. So we stand in recess. The Senate not to amend the bill, and we will, Senator Abler would put that on as an amendment in the Senate, send it over, and the House would concur. So that would be, it would sort of function as a mini conference report, and then we would keep our Senate File 4410 open to hopefully carry our agreement and become our conference report when we get our fiscal agreement.
Right.
Senator Abler?
Well, yeah, and I think that's a great idea. And so, Senator Udke, you weren't part of the discussion we had just a little bit ago, but I imagine you'd be willing to assert that any amendment, what we were talking about is that any amendment that goes on, that we are going to put on there has to be agreed by the four chairs. And so Representative Schultz should agree with that as well. But then it'll keep things very agreed.
Sounds good.
Yeah.
Right, because Right, we can't really say no amendments because what if there can be technical amendments, problems can
Right.
come up that we need to fix, but I think that's right. And we do, of course, need to make very sure that we have buy-in and approval from our leadership on both sides. That is critical. And
Yeah,
I believe we do in the House. I don't know, Senator, if you've had the chance, but.
What's
you know,
that you mean? To no amendment?
Well, yeah, just to the whole process and to the no amendments, absolutely.
We did talk to our leadership, and they're comfortable with this. I haven't seen Mr. Monahan fall out of his chair yet, but Mr. Monahan, or Madam Chair, do you mind? So what do you think?
Madam Chair, Senator Abler, I think that sounds fine. It's, at this point, it's probably a question for the reviser.
Okay.
I mean, we may turn it into a Senate amendment, but I suspect that they're doing the bulk of the work. They probably already started.
Well, Mr. Monahan, they have to do the conference report anyway, so is it very much different?
No, not really.
All right. Anyway, so, and Representative Liebling, and just to the public, what we talked about then was to keep 4410 available, and we'll see if and how an agreement comes about. And there's also just so to be fully transparent, there's also the competency restoration bill on the floor of the House, or the Senate as well, which could be, just depending how it goes, a quicker vehicle if we had to. But anyways, that's what we decided to do. So, and we're in agreement on that. Representative Liebling, back to you.
Yeah, thank you. And I think the biggest thing, you know, obviously, one way or another, all of whatever we decide gets packaged up by staff and, you know, gets voted on in both bodies. The big decision here, I think, is that we're doing this in two chunks, that we have this, you know, vote ready to leave the dock, which is our policy piece, and we want to send it on its way.
Right.
Just to make sure that, you know, it gets going in time. Because we think we've done good work here. Honestly, members, I feel like we have a really good product. I sure hope we get to the fiscal piece as well, because we need that as well. But you know, we do have some good things in the policy area.
Thanks. And Madam Chair, did you happen to look at that one section?
You know what, before I go to that, Senator,
sure.
let's let
Oh, I'm
Tony,
sorry.
let's let Representative Albright, he has his hand up. So I bet it's on the same topic, so.
He went to the library, a little studying there.
You know, because I'm an insomniac, I read, you know, books on law, you know, regardless. Chair Liebling and Chair Abler, I think one of the overarching questions that I would have is, given the time we have remaining and given the workload that nonpartisan staff and the revisor's office would be under or charged with undertaking because of the demand that we would be placing on them shortly, do we have a timeline that they have provided for us in terms of when they would anticipate the completion of the task that we would ask of them?
Well, I haven't had any direct conversation with them, Representative Albright, but it's, you know, I think it's, in other words, when would the amendment be ready for the Senate floor? When would we be taking it up? Is that kind of the concern?
Yes, Madam Chair, and I'm not trying to be coy, and I'm not trying to be anything other than, you know, authentic. But here we stand at 10:15 on Friday evening for a bill that's going to consume probably 500 or 600 pages. Are we looking at seeing first edition of this Sunday or late Saturday? And I just want to be honest with the members of this conference committee, as well as the public and the interested stakeholders to this in terms of having a fair understanding and appreciation for when they'd have an opportunity to review it.
So I don't know if any of the nonpartisan staff would care to weigh in on how long it might take to get the amendment produced, or the.
So, Madam Chair,
staff
we can certainly talk to the reviser. They have been, what you have done, we have sent to them. I think they're pretty much on top of it. This is going to be policy, so you're not going to have a big appropriations article, which is what really takes a lot of time. We really need to talk to the reviser, but I would think you would see something by tomorrow. And it wouldn't be Sunday. But, again, this is really, as Liam said, it's like, it would be the reviser putting this pretty much together, which I think for the most part they have, so.
Okay, and that's very helpful. And I just want everyone to be under, not be under any false pretenses, one way or the other. So there's an expectation that we're managing here in terms of when we would expect it, and as well as to have an understanding for both caucuses to review it, both in the chambers, as well as the minority and majority in both chambers in terms of review. So I just want to prepare everyone for an expectation that is reasonable based upon the workload that we are asking the reviser's office to undertake. Thank you, Madam Chair.
Yeah, thank you, Representative Albright. Okay,
And
so
Madam Chair?
Senator Abler.
Well,
Yeah.
just to that thought, so for the purposes of review or whatever, this is going to be a pretty big document. But so maybe as soon as they're, I don't know what ready looks like, but, to Representative Albright's point, just to make sure it gets out at least to the leadership of each caucus so they can have the privilege of enjoying a little reading there, or passing it on to people who might be interested, to the minority and majority leads or whatever. So anyway, thanks.
Yep, thank you. So that being the case, then if, since we've arrived at this, there isn't really a formal action that we need to take here in the conference committee tonight, because, and please, if the nonpartisan staff, if I'm wrong about that, please do speak up. But my understanding is that, we've adopted everything that, and of course we can talk about this other provision that Senator Abler still wants to talk about, but everything that we adopt here as a conference committee is adopted. And I think, I'm not sure what the magic words would be for us to send it off to be put together by the reviser as
Madam Chair.
as an amendment. Senator Abler.
I mean, we make motions around it. I think we can make a motion that all this work be put into an amendment, and that staff could be given direction to amend, to rewrite the whole thing if they think they could do a better job. Maybe a little less authority than that, but.
Okay, we can vote it out.
And then
All right.
after your little discussion about that little project. But I think that, Mr. Monahan, that'd be a helpful motion, wouldn't it?
I think I'm going to defer to Ms. Kavanaugh, but I think this is more a request from Senator Abler for a DE that contains the material that was adopted by the conference committee.
All right.
Because you're not actually creating a conference committee report.
No.
And your conference committee is still
Yeah.
it's still, it's still going. So this is basically, we're going to take what you've all agreed to, and it'll be a DE for this bill. And you just, you've got to have, you said you're going to make an agreement that you're not going to be amending it, but it could be amended on the floor because it's no longer conference committee. So
That's right.
that has to be the agreement. But
right.
yeah, it's just going to be, a DE, and instead of a conference committee report that the reviser will, they'll make it as a DE to this Senate file. So.
Okay.
Oh, yeah.
Representative Albright.
Thank you, Madam Chair. And to that point, and I'm not trying to dispute the iterations of agreements, but I'm not sure that that functionally we can bind either chamber or either caucus in either chamber from not amending it. I understand that it is by its very nature a de facto conference report. You're concurring to a bill that's already passed out of the chamber. I understand that. But I would lean on nonpartisan staff and legal counsel to whether or not that's a binding type of arrangement that we can make upon another chamber.
Well, I think it's pretty clear, Representative Albright, we can't bind, every legislator has an election certificate. That is absolutely clear. And so the agreement is not between the chambers as such. It's leadership agrees to behave in a certain way. The chairs would agree that we would not support an amendment that comes forward unless all 4 of us agree to it. Those are agreements between members. And what happens if you violate an agreement? Well, there's no agreement police that come and put you in jail. What happens is nobody ever trusts you again. That's what happens.
So Madam Chair?
So, yeah, well.
Madam
sure,
Chair, may I make a
Senator-
request
Yeah.
of staff?
Yeah, and Senator Benson has her hand up, though. I'd like to go to her.
Oh, well, she can go first.
before that.
I'll hold my request.
Hi, I just wanted to, for example, if one of the caucuses violates this agreement and this bill is amended, you as the authors can simply kill it. And then all this policy goes to waste because we had a DHS policy bill that had something amended onto it. And so I just didn't take it up. And so if somebody wants to play with this bill, that's what will happen. And you, as the chief authors of whatever the vehicle is, stay in control and can kill it. And it would be a shame if that happened. But we can't bind other legislators. But you, as the authors, committing to each other to not accept amendments can then kill whatever's done. It makes the floor really hard for the majority parties in each chamber, but that's how it would operationalize.
Right. Thank you, Senator. I remember when that happened. Yes, indeed. You speak from experience. I do recall that.
So Madam Chair?
So, yes, Senator Abler.
So just, I don't know if we're kind of wrapping up. There's just that one little thing you have to talk about. But just since we're in this topic, so would it be appropriate if I made a request to our staff and to your staff or whoever to prepare a delete all amendment for House File 4065, including all the stuff we did here? And how would that be?
Yes.
Okay.
Yes,
well,
and
I'm
I
making
would
that
make a
request, Madam
parallel-
Chair. That's my
Thank
request.
you.
Thank you.
Thank you very much, Senator. And I would make a parallel request to the House staff to assist in whatever way they can to, accomplish that task if their assistance is requested. Since everyone worked on that together. And then, there's usually some magic words we say at the end of when we're wrapping up a bill, an omnibus bill in committee, and that has to do with giving permission to do corrections that become necessary and so on. I don't know, Ms. Kavanaugh, is
Madam
that
Chair, I don't
something-
think you need to do that because we'll just make it. And if, it's going to be an amendment that you're going to have to vote on. And we did, I think, Mr. Monahan did contact the reviser, and it sounds like they could get articles out by around noon tomorrow. So obviously we'd have to look at it, but so, tomorrow afternoon is doable.
All right, well, thank you.
Madam Chair?
Yeah.
My request
Senator
could
Abler.
include that if they discover some drafting error by chance, but they know our intent, that they could kind of tidy that up. But anything substantive would have to go back to the 4 of us. How's that?
Yeah, I think that sounds
That's
really
all part of
good,
my
and
request.
Yes, thank you. And I see heads nodding there. So,
Nodding heads.
yes, Senator Benson.
Yep, Senator Abler, the motion would be to make technical and conforming changes. That's the instruction to staff.
Sure, that's my request. That's what I'm requesting, staff, so, thank you.
All right, well, that's excellent. Okay, so Senator Abler, you wanted to talk about another provision that you were interested in, and I think that's Representative Schultz has some information on it. So why don't you go ahead and
Sure, please.
present that and then she can
Representative Schultz, I'll just sit and listen to her comments.
Well, why don't you just sort of introduce for everybody what it is, and then we'll let her
Oh, sure.
respond with what she knows about it.
As I was looking for, actually, last year, the governor, I think, wanted to get rid of this program, and I thought it had merit. And I thought if we're going to get rid of it, I'd rather turn the money into something productive. So in our original work, I did give staff instruction to do that. It was like $8 million, and actually they used like 2/3 of it or 3/4 of it. So I didn't want to undo what people are doing. This particular program has a 15% county share, so it's used a little bit less generously. So it occurred to me that if we could capture the money at the end of the biennium and then appropriate that to the MCELs, that would actually accomplish the same purpose for the money in, you know, at least exhaust the entire fund. So, and that's what we wrote down.
Okay, and so Chair Schultz, do you want to pop in here with what? Because I let her know, you know, when we went and looked it up and so on.
And we never talked about this.
Yeah.
We did, I was not consulted by Senator Abler, but I understand your intent, Senator Abler, and it sounds like we have work to do on this because it can't be implemented as it's written in the Senate bill. There's some legislative budget rules that we would violate on how to treat these unspent appropriations. So we would need to deal with that. And I think there's a cost when you try to transfer these as well. So it might be a cost item. But apparently, you know, some of the SILs have been turning down funding because they don't have capacity. So we should probably consult with them as well. And the SILS is a direct service to people with developmental disabilities. So if we're going to do any reallocating, it might be wise to consider another purpose, potentially a competitive grant process that has a direct impact on people. I don't know. I have some ideas that we could talk about when we talk about our spending bill.
Very well, thank you.
But I don't think we can do it in the policy bill.
Very well, thank you.
Okay, but as usual, Senator Abler, it's great that you know, try to address these problems. It's just, you know.
No, that's fine. Thank you.
Yeah, thank you for your intention there. Maybe you can work something out. Maybe you can get something going on that. So is there anything else then that members need to bring up before we proceed here? And we've got the, given the
Madam Chair.
direction to staff. Senator.
So tomorrow, I have no idea what is going to happen. So it'll be at the call of the chair. I don't know what would provoke a meeting. But so if there was some purpose, you know, we'll keep in touch. We're going to be updating our offer based upon the mental health bill that's slated to pass, and we'll be passing that over to you. And so actually, we would appreciate some kind of formal reaction to what we did. We thought we made some movement that you would find productive, and I think given our beliefs about the kind of money that is necessary, I think the 820 million is not a number that's very amendable. So, but I appreciate that, and I'm trying to say it nice. So we'll get that sorted out and get that off to you. I don't know when, but soon or tomorrow morning. Or do you want it yet tonight? I don't know if we can get it yet.
Yes,
yes. Senator, we want it as soon as you can get it to us because, you know, I think everybody understands here. If we don't reach an agreement, nobody gets anything. So
Understood.
This is really, I mean, I just, you know,
all right.
We really have to get down to business here.
We'll sit up and work it. We'll get it out tonight.
All right. All right. And I
Thank
do
you.
want to, before we conclude here, I do want to, we should all sing happy birthday. Not really. Not sing it, but it is Chair Schultz's birthday today.
No kidding.
And what a way to spend a birthday, right?
Well, Madam Chair, we have this room is packed with people that would love to sing to them. Is that appropriate?
No, it's not.
I don't know, they're kind of itching. They're all on their feet with their arms waving.
Chair Abler, they can help us get this bill passed.
Okay, well,
The spending bill, that's what I want for my birthday.
all right, so
Yeah,
I don't know, they're
getting this bill
disappointed.
out,
There's a
yeah.
lot of sad faces out there, Madam Chair. They were kind of keen for a little, maybe get some karaoke going a little bit too, so.
All right, well,
Thank you,
maybe
Madam Chair,
after,
I'm
we
done.
after we pass our fiscal bill, we can, then we can, you know, have some celebration.
Happy birthday,
Senator.
Jennifer, thanks.
All right. So with that, everyone, thank you again so much to everybody and to the staff. And so we look forward to, we hope, coming together to approve or at least admire an agreement on a fiscal bill before it's too late to pass one. So, all right. Thank you, everybody.
Thank you, Madam
We are-
Chair, good meeting.
We are adjourned.